Hi, my name is Ikechukwu Asanoki. I'm founder and CEO of Zuri Health. I'm happy to be at the Inter-African Trade Fair in Algiers, Algeria. In 2018, I, in another life, was responsible for building the creative aspect of the Inter-African Trade Fair by bringing an artist across Africa to come and perform, and that was in Cairo, Egypt. And here am I in another world in Zuri Health, building Africa's biggest health tech companies. And we're here under the Timbuktu UNDP initiative to see opportunities across the 54 markets in Africa. Yes, I see everything as a fantastic opportunity to open up markets across Africa. Part of Zuri's strategic push is to build every African city by 2028, and we're working seriously towards that opportunity. Zuri Health is currently in 9 markets today, and coming big, it is an opportunity to understand North Africa. Part of our new strategic opportunities to launch in Algeria, Morocco, Tunisia, and Egypt. So we think that is a very big way for us to be able to stream it. Fantastic. We've scaled access to healthcare in Kenya. We're the biggest traditional healthcare company in Kenya with over 3 million patients seen. And with our experience unlocking access to healthcare in multiple African countries, with 9 countries today, I think we bring in a unique perspective into understanding homegrown African solutions for African problems. And that is why we're here, to connect opportunities, open up all markets, and see how we could take our examples of what we've done successfully in other African countries and bring it to across the continent. I think you cannot divorce healthcare from economic activity. Healthcare is a fundamental human right. When people have access to healthcare, affordable healthcare, then they can be productive, right? So one of the key things is how we can unlock economic value chain across the continent. And doing that is investing in access to affordable, preventable healthcare, to ensuring that the productive people on the continent are healthy enough to engage in meaningful production. And whatever opportunity that will open up in this streets is, we'll need people to do it, and we'll need healthy people. So it is important for us to invest in ensuring that we have a productive, healthy and productive workforce. Partnership with a lot of corporate fellow SMEs, how we can build in the Zuri Health solutions in their various offerings. Partnership with the government and policy makers, because we cannot innovate outside policy frameworks, ensuring that we lobby effectively for policies, or what we call progressive digital policies that support what we do actually have. Yes, Zuri Health has in Kenya seen over 3 million patients. Over 150,000 people have been put on our continuous care program. In fact, in most of the counties or states where we've done our medical camps, we've reduced incidence of NCD by a whopping 73%. And this is part of what we want to do. Take that template and one of the exciting things we've done across healthcare and build it across the continent. What we're doing with Petals, which is our women health platform, which looks at the women's healthcare journey from menstruation to menopause. All these are things that we are looking towards building, and across Africa, looking at the experiences we've had in Kenya, in Ghana, in Zambia, in Cameroon, Senegal, Nigeria, and that's what we want to take across Africa.